Zantane is our newest medication for treating mild to severe cases of depression. And during the next section of this lesson, we'll discuss some of the most common concerns voiced by patients and physicians and how to address those concerns. Now, your customers will always have many questions, and nothing can hinder a potential sale more than not knowing the best answer. So, let's continue. Now, as you know, Zantane treats depression and anxiety, and it belongs to a class of drugs known as SSRIs, or selective serotonin reuptake inhibitors. Zantane works to correct a chemical imbalance in the brain that may be related to symptoms of depression or anxiety. It has been tested extensively with thousands of patients, and its results are very encouraging. There are many antidepressant drugs available, so why do we think Zantane will be popular? Why should it be prescribed instead of the wide variety of other antidepressants? Well, we think there are 5 points that you should stress. First, Zantane doesn't have the potential for problematic side effects that other antidepressants do. Tricyclic drugs, for example, can cause heart problems and dangerous effects on blood pressure. Zantane, like all other SSRIs, does not pose that risk. Second, Zantane is also indicated for use for a variety of depression's commonly comorbid disorders. It has been approved by the FDA to treat social anxiety disorder, post-traumatic stress disorder, panic disorder, obsessive-compulsive disorder, and premenstrual dysphoric disorder. This capacity for treating multiple disorders can be attractive to physicians who want to limit the total number of medications that they prescribe. Third, Zantane has not been shown to induce weight gain, which is a side effect that frequently concerns patients. It also has been extensively researched for use with pregnant women and has no statistically significant side effects. Now, these two advantages make it particularly appealing to women and in turn can be an important sales tool, particularly in the OBGYN market. Fourth, Zantane interacts with other drugs much less than its competitors. I'll let Dr. Malloy explain this to you.
Yeah, most SSRIs they're very tightly bound to plasma proteins, and that makes them dangerous to take with other drugs that are also tightly bound to proteins. So, for example, warfarin or digitoxin. On the other hand, Zantane's protein bind is qualitatively different. So this makes it much safer in terms of drug interactions, and there are many fewer contraindications. And this fact is going to be particularly attractive to physicians who are trying to simplify that whole battery of drugs that they have to prescribe on a daily basis.
Finally, Zantane is easy to take. The several times a day dosing pattern of many other antidepressants make them very difficult to use. The simple once-a-day regimen makes taking Zantane an easy pursuit. Now, physicians will definitely have questions for you, and you need to be ready with the best possible answers. By far, the most common questions that doctors will ask is, what are the likely side effects? Well, as with other SSRIs, the most common side effects are dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness. Of course, you should remind the physicians that not everyone gets side effects. Furthermore, you can remind doctors that most of these side effects lessen over time. And if the symptoms do not reduce, then it's important that the doctors make sure these side effects aren't a sign of a more serious condition, such as serotonin syndrome. Now, another question that you will get is whether Zantane will affect suicidal tendencies. This concern is especially pressing because of the FDA's warning on all antidepressants. Now, I would begin by reminding doctors that depression is a very serious medical condition which can, of itself, lead to suicidal thoughts and behavior. Furthermore, some evidence has suggested that children, adolescents, and young adults taking antidepressants may increase the risk for suicidal thoughts and behavior within the first few months of treatment. Now, this risk is small, but real, and you need to provide an appropriate level of gravity. Point out that while the risk of suicidal thoughts is concerning, it must be balanced with the patient's broader medical needs. Now, those starting medication or changing doses should be watched closely for suicidal thoughts, worsening of depression, or unusual changes in mood or behavior. In children and teens, Zantane is only approved for use in those with obsessive-compulsive disorder. If doctors seem especially concerned about this issue, you might provide them with our booklet, Antidepressants, Medicines, and the Risk of Suicidal Thoughts or Actions. Another common question is how long it takes for Zantane to be effective. This is important because it's an area where our product may be at a competitive disadvantage. Well, you should explain that Zantane, along with most other antidepressants, need up to 2 months to take effect. In this regard, your physician may mention research out of NYU showing that the competing product Liftel may produce effects more quickly than Zantane. Well, if your doctor mentions this issue, you can point out that this claim seems unlikely since the effective speed of SSRIs should be the same for all types since they all act using the same mechanism. You can also point to recent research coming out of Durham University in the UK that is called the NYU research into question. Finally, you should point out that Liftel also seems to produce significantly more sleep disturbance and weight gain. Now, the fact is that many physicians have already established their prescribing patterns and have selected their first choice antidepressant. Now, for example, if you check the prescription database, you might learn that Dr. Smith always seems to place her patients on a course of Zoloft. Well, in cases where the doctor seems committed to a particular medication, you may lose credibility by prodding them to switch. Well, in these cases, it might be a better idea to encourage them to consider Zantane as the backup medication. As you may know, it often takes patients 3 or more attempts to find the antidepressant medication that works for them. We think that Zantane can make an excellent backup choice, and it may be the best way to get in the door and eventually become the doctor's primary choice. So now that you know some basic information about this drug, let's talk about how we can apply our general marketing techniques to selling this medication. Now, as always, the first step in making a sale is to know your audience. This is related to knowing your product. Let me give you an example. One known side effect from Zantane is a reduction in appetite. Now, this may seem like a negative, but it can be perceived as a selling point for some audiences. For example, if your physician treats diabetics, they may regard the appetite suppression as a desirable secondary effect since it reduces unhealthy food cravings. Likewise, it may be desirable for doctors who treat obese clients. A second key sales strategy is to target your market. Now, we expect to provide an extensive television direct marketing campaign that is directed to women, and in particular, women of higher socioeconomic categories. Therefore, you might focus on OBGYNs who practice in a particular market. That said, it's important to keep our entire body of products in mind. Now, qualifying a doctor means understanding his or her relative potential, including their relationship to your entire business. The third key sales strategy, and this is especially important in the area of psychotropic drugs, is to provide recommendations. If Dr. Smith is a young physician, you might want to mention that an influential physician in your territory has had good luck with Zantane. You should also be ready with a list of psychiatrists within your territory who are using Zantane. Now, these referrals can be particularly influential. As you may know, the depression therapy market is one of the largest in the world, and several antidepressants have achieved blockbuster status. Although the market for antidepressants continues to grow, the rate of growth has slowed, in part because of generics competition. By 2010, the market-leading antidepressants will all face generics competition, at least in the US. In the following section, we will show you some interactive video vignettes that demonstrate how you can sell Zantane against generic products.